Hello friends, and welcome back to my channel. Today I would like to talk to you about one of the questions I get asked the most frequently in the studio as a professional piercer. And that is, why do I have to wait so damn long to put a hoop in my cartilage piercing? Now, when I say cartilage piercing, I am talking about any cartilage that we're piercing through on the body. So nostril piercings, helix piercings. Honestly, I get asked this probably the most often with nostril piercings. People come in really envisioning this like super cute, snug, dainty little ring in their nose and super, super excited for this hoop. And when we tell them that it's much easier to heal with a stud, they listen and they're like, okay, yeah, that makes sense. You're telling me that the hoop is going to have to be big and oversized. I don't know if I like the look of that. Healing's going to be easier with a stud. Okay, all of this stuff makes sense to me. I'll get a pierce with a stud. How long could it be before I'm in my hoop? A couple of weeks? And then we tell folks that it takes 6 to 9 months, sometimes a year, for it to be fully healed before we're ready for a hoop. And that's when folks are less understanding and less excited. And many folks are like, what do you mean it could be 9 months to a year before I'm putting a hoop in my nose? Like, that's a very long time. So I wanted to come on here and make a little video about why it takes so long for your piercing to be ready for a hoop. Now, first of all, I'm not saying in this video that it is impossible to heal with a hoop. It's just significantly more difficult, and realistically, 99% of clients are not cut out for, say, healing an initial nostril piercing with a ring. If we are going to pierce with a ring and we want it to be successful, first of all, it's not going to be this snug, thin, delicate little hoop that you like, because it's going to need to have room for swelling and healing. So a hoop would have to be a thicker gauge, and it would have to be a much larger diameter to have room for swelling and healing. So it's not going to be nice and snug to your nose. It's going to be a pretty big, chunky, oversized hoop. And most folks do not like the aesthetic of a big ring like that. I show them pictures of what that would look like, and they go, I don't like how that looks. It's way too big. Which, fair. Most people want something dainty and snug. But even with that properly fitted hoop, it is so much easier to get caught and snagged taking your shirts on and off, washing your face, in the shower, on your pillowcase, cuddling your partner, giving your friend a hug, petting your dog or your cat and like giving them little kisses. Like, it is just phenomenally easier to get those big chunky rings caught. And each time they get caught or snagged, that can cause irritation bumps. It can cause issues for the healing process. It just makes healing way more difficult. So on the rare occasion that I do have a client who's like, no, yeah, like I'm down, like let's do it with a hoop, the vast majority of the time they come in around the 1 to 2 month mark and go, just put the frickin' stud in. This is way too hard for me to handle with a hoop. Which, again, fair, reasonable. That's why we try and warn you out of healing with a hoop. That's why we suggest healing with a stud. It's going to be much easier for most folks, much more comfortable, much less likely to get caught and snagged, much less likely to deal with irritation bumps. Like, it's just going to be easier for the majority of clients across the board. But why then do you have to wait so long from getting pierced with your stud to switching it to a ring? And that really comes down to how our body heals and how long it takes our body to heal. So to start, let's talk about the wound healing process. This is your content warning that I'm going to be putting up some pictures and diagrams of wound healing. These are going to be surgical wounds or accidental wounds. We're going to see them through their process of healing. If you don't like seeing medical images or things like that, maybe skip the rest of this video, but this is your warning. So when we're giving folks that time frame on waiting to put a hoop in, we're doing so because we're thinking about how long it takes that piercing to fully heal. And when we say fully healed, we mean being ready to have the jewelry taken in and out, to have a snug, tight fit hoop in. That piercing channel needs to be ready for all of these things that we want to do with it. So what does that healing process entail? Well, when we're doing a new piercing, we're literally creating a fresh wound, a tunnel of broken skin in the body, and then we're putting a foreign object in that wound, and we're asking the body to heal new skin all of the way around this foreign object that's trapped in this wound, that's wiggling back and forth, and sometimes getting caught and snagged, and sometimes getting bumped around. And this is a monumental amount of work that we are asking our body to do. This is kind of the worst case scenario for our body when it comes to trying to heal a wound. Short of having like a genuine bacterial infection, trying to heal a wound with a foreign object trapped in it is incredibly complicated for our body to do. Even when we just look at traditional wound healing with wounds that are surgically created and then surgically closed, the healing process can be very time consuming. Take a look at this diagram of wound healing. So if we look at the very first section, that's kind of what our wound looks like initially. And then let's kind of scroll through how it looks as it's healing. We can see as it progresses through the stages of healing that new shiny pink skin starting to encroach from the edges of the wound inward and starting to slowly close that wound. The longer the wound heals, the more the body is producing that new skin. We see that darker scabbed area getting smaller and smaller until finally at the end we have just that shiny pink skin. Now, wounds heal from the outside in, so it tends to be very similar for piercings. The outside portions of your piercing heal first, and your body heals those in towards the intercenter section of the piercing. So already this can be a process that takes a while. Now, the last time I had major surgery, I had a tubal ligation back in 2022. Some of the stubborn scabs at my incision points stuck around for about 2.5, 3 months before falling off because there was fully healthy new skin underneath it. So that's a surgically created wound, surgically closed, and there's no foreign object trapped in it. And I still had scabs showing that healing was still occurring at around that 3-month mark. So it takes our body quite a long time to be able to grow new skin and do so to completely line the channel of a wound and completely heal it up. This takes even longer when we're talking about wounds through cartilage because cartilage is avascular. It doesn't have the same amount of blood flow and vascularity that the soft tissue of the rest of our face or our arm or our stomach has. Cartilage, like in our nose and our ears, has a lower blood flow. So it takes a lot longer for those white blood cells and those building blocks of wound healing to make it to the area to heal it. So already wound healing takes a while. We have to wait for the body to literally grow new skin to close the wound. And we're talking about piercings that are in an area that has lower blood flow. So it takes a lot more work for our bodies to heal this up. Then we add in the element of having jewelry in the piercing. And no matter how careful and cautious and conscientious you are, you're going to occasionally bump your piercing. You're going to occasionally hit it taking your shirt off. You're going to snag it washing your face. You're going to sleep on it funky. We're going to do things that agitate that healing skin. If you've ever had like a scrape on your elbow or on your knee, you know you just bend the wrong way and that breaks right open. That's one of the most frustrating parts about healing a skinned knee or a skinned elbow. You keep breaking that scab off and breaking that wound back open, and it takes a really long time to heal because of that. We are essentially doing the same thing over and over when we're healing a body piercing. When we're catching and snagging our jewelry, when we're bumping it, we're breaking that scab, we're damaging that fragile healing tissue that's on the inside of our piercing, and we're reopening the wound and making our body go through that healing process again and again and again. Our body is designed to push out foreign objects because it's so hard for them to heal with these foreign objects in place. That's why we deal with things like rejection and migration on piercings that are closer to the surface of the skin. But even in placements where rejection and migration isn't likely, the regular boops and bumps and snags that come with life are enough to prolong that healing process and make it much harder for our body to build that new skin. And if we come back and revisit that final healed photo from this wound healing diagram, notice how the skin is that shiny pink color and texture. I don't personally consider this fully healed because, again, if you've ever skinned your elbow or your knee or had a big scar or a cut, you know that that shiny pink skin is pretty fragile. If you even just like scratch at it, it'll break back open. If you're not gentle with it, it'll break back open. And it tends to be either like not have much feeling or be very sensitive. So I don't consider that fully healed until it looks more like this. This is a very well-healed scar. We can see it's closer to skin color. It has more normal texture. It doesn't have that shininess. This is the point where I would consider it fully healed. And when it comes to a body piercing, this is the point where we can talk about doing really fitted jewelry and really snug hoops. Because yes, at like 4 months or maybe 5 months, your nostril piercing on the inside probably looks like this. It probably looks like the shiny pink skin picture. There's probably no longer an open wound. There's probably no longer like any raw spots inside it. Probably, not definitely. I for sure take a year to heal. I get allergies. I get sick all the time. I have a skin condition that makes my healing slower. So for me, I absolutely do not have this shiny pink skin until much further in the healing process. Before our like average hypothetical client, around that 5-6 month mark, we're probably seeing the interior of the piercing looking more like this with that shiny pink skin. But like I mentioned, that shiny pink skin is fragile. So if I just take a really snug fitted hoop and put that in the piercing, and now I'm taking the piercing that has previously been a straight bar and I'm curving it into that shape of the hoop, and it fits pretty tight since we want that nice, snug, delicate fit, that shiny pink skin is not ready to be bent into this new shape and have all this pressure put on it from the ring. Because that's what this snug fit ring does. Take a look at this diagram. It's putting pressure on the entry and exit of the piercing on both sides. So when our piercing is in that stage where it's got that shiny pink skin, sure, it's healed in the sense that it's not an open wound, but it is not healed in the sense that we can do things like put in a really snug fit piece of jewelry or a really big piece of jewelry that's gonna be easy to get caught or snagged or moved around. We wanna wait until it's that nice skin tone, matte, healthy, 100% healed wound, like this one. And that final portion of the wound healing process takes a long time. I have multiple pieces of scarification on my body, and after they no longer were like a raw open wound or a scab, they were that shiny, raised, tight scar tissue. Even just wearing certain fabrics over them was very uncomfortable, and it took close to a full year for that scar tissue to settle down and become that healthy skin tone, softer, more flexible, more supple tissue that is what we consider a 100% fully healed wound. And it's not until the inside of your piercing channel is that fully healed tissue that we can then safely put it into a nice, tight fitting ring and not have any adverse side effects. Because once that tissue is healthy and strong, we can put it into that curved piece and it's gonna flex around that piece no problem. The tissue is healthy, it's flexible, it's fully healed, we can put it into a bunch of different shapes and it's going to be okay. But until it's at that point, if we try and put it into a ring too soon, that fragile, shiny pink skin can easily break back open and have an open wound. It can get irritated and have issues very easily. And that's why sometimes people are like, oh, my piercing feels totally healed. There's no more crust. It's like 5 months old. I'm gonna put this super snug ring in it. And out of nowhere, seemingly, they get a bump on it. And they're like, well, what the heck? My piercing was healed. Why can't I put it into a ring? This doesn't make any sense. Well, the piercing wasn't healed in the sense of where we want it to be able to wear a snug hoop. This is why most piercers give a timeline of anywhere from 6 to 12 months before they'll put folks into a nostril ring. 6 to 9 months tends to be pretty reasonable time frame for someone who is like an average healer, but more and more often we're seeing people who, because of various reasons and conditions, do take longer to heal. Folks with autoimmune conditions, people with diabetes, people with PCOS, people with EDS, psoriasis, rosacea, people who are taking certain medications that can affect their immune system or affect how their body heals or affect blood flow and blood supply throughout their body. People taking medications that affect their skin, including acne medications, some hormonal medications, including birth control. We're also seeing people struggling with immune health issues due to long COVID. There's lots of factors that affect how our bodies heal things. And so I've seen many piercers whose work I admire and look up to talking about increasing their wait times before putting clients into nose rings because they're so frequently seeing clients have issues from swapping into this jewelry too soon. Because it's taking our bodies such a long time to go from that shiny pink skin stage to that fully supple, fully healthy, fully healed scar tissue. And when we try and put that hoop in too soon in that process, we reset that healing process back because we damage that fragile tissue that's healing inside your piercing. I say it all the time on my channel and in my piercing room, but piercings are all about patience, and that couldn't be more true. The best thing you can do for taking care of your piercing is being patient with it, giving it plenty of time to heal, not rushing to getting your gold jewelry or a hoop or chains or whatever the piece may be, and just being really patient and letting it heal with simple jewelry that is the easiest to keep clean, easiest to care for, and least likely to get caught and snagged. When we think about it from the perspective of how a wound heals and what is happening on a cellular level inside our piercings during this process, I think it makes a lot more sense why piercers are so cautious about how quickly we'll put people into hoops and why we encourage folks to wait and be patient. I hope that by talking a little bit about the wound healing process and also showing some of these really good example images, you have a better concept of what's happening on the inside of your piercings while they're healing, and a better concept of why we want you to just be patient and wait. And the longer you wait, the more time you give your piercings, the easier that transition is going to be. There's fewer, more effortless transitions to a hoop than someone who's just had their nostril pierced for a few years and has decided now that they're ready for a hoop. Those are always the most satisfying, best fittings that I do, because I know beyond a shadow of a doubt that they're healed, healthy, and ready. And also, folks, please remember, if you are someone who does have a slower or more prolonged healing process, that is okay. I understand. Trust me, I understand as someone with psoriasis and as a professional piercer how frustrating it is when your own piercings take so much longer to heal than all of your friends. I've always been someone who couldn't even think about changing to a fancier stud, let alone a hoop, for the entire first year with most of my piercings. And I used to feel really guilty that meant that I was bad at having piercings or a bad healer. It took me a long time to come to terms with the fact that I just have an autoimmune-based skin condition. This is just how my body heals. And there's absolutely nothing wrong with that. And now I respect my body and I give it the patience and time that it needs to heal fully before I start messing around with a bunch of stuff. I hope this video helps explain why we encourage you to wait. And next time you can't resist that urge to try and get something changed out a little too soon, come back, revisit this video, and remind yourself that the best thing you can do for your piercing while it's healing is be patient. Thanks so much for sitting down and hanging out, and I can't wait to chat with y'all again soon. Bye.